Welcome to the Spark Standards in Action Showcase, where active Spark community implementers share their perspectives, experiences, and example implementations of some of the fire implementation guides designed by the Spark community. Here we will have community representatives showing the art of what's possible using the community design specifications to enable safer, more connected, and more efficient healthcare. I'm your host, Michael Hosking, Deputy Lead for Community and Engagement for Sparked. For this showcase, we'll jump straight into the discussion. For a background on Sparked, what it is, our goals, and related resources, please visit sparked.csiro.au. Today, we're joined by Dr. Felicity Hodder and Nicole Sun. A brief introduction to them. Felicity brings over 2 decades of experience in healthcare, combining clinical leadership with digital transformation. At InterSystems, she supports implementation programs and contributes to national fire standards through the Sparked Clinical Design Group. Nicole Sun has a strong background in software development, particularly in EMR systems. Now a sales engineer at InterSystems, she helps healthcare organisations adopt scalable, data-driven technologies, drawing on her experience in both engineering and clinical workflows. Thanks both for joining us and sharing your experiences and also sharing a demo. We're really excited to see it. So, starting off with the first question, the first question being, what are your current challenges of health information sharing in Australia, Felicity?
Well, I just want to open with, imagine a health system where data flows seamlessly, ensuring safer care, faster insights, and better patient outcomes. That's the promise of FHIR, and that's why we're here. As far as the problem we're trying to solve, before Sparked, Australia's digital landscape was full of passionate efforts, but often working in silos. As a clinician, I know how fragmented data can place unnecessary strain on both patients and providers. We relied on faxes, emails, custom-built integrations to share health information. These methods are slow, expensive, and prone to error. Clinical systems couldn't speak the same language, and the data we did exchange was often inconsistent or incomplete. And you can only imagine how that would impact patient care and outcomes. So this fragmentation affected everything. It limited visibility at the point of care, it compromised patient safety, and it created massive barriers to innovation in healthcare delivery. And, research, as you know, I'm a clinician, a pediatric oncologist by background, and I know the power of collaboration and speaking the same language. We advanced outcomes in pediatric cancer from virtually nothing to 90% because we were able to speak the same language across the globe, and collaborating with our colleagues to research. We had to know and speak the same language. And this is what we're talking about here. And we're all a part of this effort to do this. But now these young people do so well after 20 years of care, they need a passport, a summary that goes with them, and it needs to be global. So it needs to speak the same language across the globe for these young people to receive the healthcare they need to live their greatest lives. So that's really where Spark came in. And Australia took a bold leap in digital care. In August 2023, the National Fire Accelerator Spark was ignited. How amazing. And look at where we are now. It was backed by a powerful consortium, and it's really the first of its kind, bringing government, industry, vendors, and clinicians together to co-design the standards that we will use across nationally and then eventually, I believe, internationally. So that's why I think Spark matters.
Absolutely. And why is InterSystems involved?
I think because we're a founding member of Sparked, and we're very proud to be a part of the work to develop standards. And we believe this is this is healthcare providers and building for the healthcare community. And it's not about top-down mandates, it's about collaboration and innovation and interoperability that reflects the reality of Australian healthcare. And we just really believe in that kind of process. And we've been involved in both the clinical design workshops and the technology, and connectathons, which is a great way to really connect across this work.
Yeah, and being active with Spark, it ensure our Iris for Health and related products are aligned with latest AU fire standards. So our customer can adopt them as soon as they're released if they want to. And it also enable customers to leverage their existing investment in our technology while also give us the opportunity to contribute our expertise together and collaborate with other experts to shape the standard that are practical and ready for the real world.
That's fantastic. And which fire standards are you implementing?
So for ours, for health, is aligned with the AU core implementation guide, and we have been working closely with Spark to ensure full support for these standards. So the goal is to enable immediate adoption by our customers as soon as they are ready to implement AU Core. So our platform can support them out of box. And in terms of AU patient summary and e-requesting, these standards are more directly related to our EMR side. I'll hand over to Felicity, who leads the area and can provide more details.
So InterSystems, as you know, is a global company where we're present in over 80 countries in the world. And I think that we are really committed to the two key standards and then the AU clinical summary. So the Fire Core specification enables structured real-time access to clinical data using the national fire profiles based on the AU CDI. So this will be an important part of our EMR being able to speak that language when clinicians enter data, the terms they select, the language they speak will be Fire Core, will be core. And then this is obviously then a key component that leads into the building of that patient summary that I mentioned briefly before. And I think it's really important because AUCDI is a national asset. It's underpinned by the AU requesting data information specification as well. So it's vendor neutral, it's use case agnostic, and was built with input from clinicians and technologists. It's reusable and it's standardized. So I think this is about that common language we talked about. It's a bridge.
Yeah,
Data information, semantically accurate. Yes.
Yes, no, that's great. That sounds really good. And I guess, Nicole, it'd be great if you could show us what that looks like in practice in terms of your system. So if you could share a demo with us, that would be great.
Sure.
Hi everyone. I'm going to show the Smart on Fire EHR launch with Iris for Health. Let's start. This is the Smart EHR Launcher, which is an open source application I have deployed on my local PC. At the back end, it has been connected to Iris for Health file server on the EC2 instance. All this information about the patient and the practitioner here, they are AU core file resources on the file server. In this demo, we want to focus on these two launch buttons. These two launch buttons will trigger the Smart on Fire process to allow the applications to be launched and to access the information on the file server. Let's have a look at the first one. Once I click the button, it triggers the OAuth 2 process. In this process, it will go through the Smart on Fire orchestration, allows the application to access some informations from the file server. We can see the patient information which required for this application has been brought across. There are only a few informations that are not on the file server, that's why they are not here. I just manually enter them. Finish the forms. So once the result has been calculated, we can save the result back into a file server. Once the result is saved back into file server, this result can be accessed by the EHR itself. This is the first example. Let's take a look at the second example. I want to show the second example, just want to show you how easy different applications can be launched through the similar process for the same EHR application. Here, we launch the OAuth2 process for the Smart on Fire again, and we allow this application to access the practitioner and the patient information. The process itself is very similar. The applications are very different. So this is the end of the demonstration. Hopefully give you some idea how we can use Smart on Fire to launch smart applications to access some information from the fire server with a very secure way. So this is the overview of how we can use Smart on Fire to enable secure and standard-based application integration. Thank you.
Okay. Thanks very much for the demo. That was really insightful. And now, Nicole, did you have any insights that you wanted to share with us in addition to what you just showed us?
Yeah, what you have seen was the Smart on Fire demo. So the standardization is what makes Smart on Fire integration so seamless. The coolest part is that I don't really need to work directly with the teams that build the smart apps. So as long as both sides follow the standards, the integration just works when we connect. So the Smart on Fire launch works perfect with no complicated coordination. So we just need to set up some client ID, blah, blah, then very easily we can connect, just like magic. That's the power of shared standards.
Great. And how are you looking to implement the patient summary and e-requesting and other Sparked Fire implementation guides?
So we will plan to initially do that around our clinical summary process, which I think is what we're really targeting. Fire Core enables the system to query patient summaries, medications, and allergies across facilities. And the e-requesting allows clinicians to place standardized test orders. So our physician ordering functionality will be supported by the fire standards that are being developed. And all those listening can join us to do this work.
Absolutely. That's great. Good to hear. And why should others get involved in Sparked?
So getting involved with Spark means having direct voice in shaping how fire standards are defined and adopted across Australia. So rather than adapting to standards after they are published, you get opportunity to influence them early, make sure they are practical, implementable, and align with the real world examples. It's not something out of the blue. So it also gives you access to the network of industry peers, government, and vendors, helping you stay ahead of upcoming changes and ensuring your product and services are future ready. So the Connect Zones is another very powerful platform for each other to be able to connect with each other, testing the use cases, make sure everything actually aligns with the real world. And ultimately, participating in Spark helps accelerate interoperability and innovation, while ensuring your organization and your customers, you are well positioned to benefit from Australian digital health innovation. So it is a very great program.
Oh, good.
Yeah, Sparked is an incredible forum, not just for learning from the community, but for contributing to the development of standards that are both ambitious and achievable.
Thanks,
So,
Dorothy.
better health needs better data, and Sparked is making that possible. Through open collaboration and modern standards and real-world implementation, we're moving toward a truly connected healthcare system. Can you imagine what that will be like?
I know.
Just
That's the
amazing.
goal. That's the goal.
It'll be safer, smarter, and centered around patients. And thank you for being part of this journey. And we're just getting started. So join us.
Exactly. And finally, what's one final insight that you'd share with others adopting these national fire standards, Nicole?
So by adopting standards like AU Core, you reduce the integration complexity, enable smoother collaboration across systems, and it makes it a lot easier for downstream use cases like clinical decision support, data reuse, and Smart on Fire, which you have already seen. And these kind of things, it means you are not building a silo isolated system anymore. You're connected with others.
Absolutely, well said. So with that, thank you very much for your time. Really appreciate your input as a community members. We really appreciate everything that you do. And if you're interested as a listener in participating in Sparked, we've included a QR code that will take you directly through to registering. But also, please feel free to jump onto our website to explore and have a poke around. We also have a podcast. Season 1's out for those interested, and we're currently working on Season 2. And we have a lot of information and updates that we share on LinkedIn as well. And lastly, if you have any questions, you can email us at sparked@csiro.au. Thanks very much, Nicole and Felicity. Appreciate your time.
Thank you.
Oh, you're welcome.